Why don't I do the first two slides?
Sure.
Good evening. Thank you everyone for joining us for this evening's webinar, which is all about, is CanopyCare right for me? My name is Jessica Shee, and I'm the Communications Director here at the San Francisco Health Service System. And I'm just going to give you a brief overview before we hand it off to our presenters. Could you go to the next slide? Thank you. And so for this entire presentation, you'll be on mute. However, we do love it when you send us questions. So on your menu bar, which may be at the top or bottom of your screen, depending on whether you're joining from your computer or mobile device, please find your menu bar and select the little question mark icon button. If you hit that, it'll open up a live Q&A chat box, and that's how you can send us your questions, and we will be happy to answer them throughout the presentation and during the live Q&A session right after the presentation. And without further ado, I will let Cameron take it off.
Thanks, Jessica. Thank you all for joining us today to learn about the exciting new health plan option available to you and your families, HealthNet CanopyCare HMO. The speakers today will be Mike Robinson, CEO of Canopy Health, Andrea Kometz, Senior Director of Clinical Operations at Canopy, Tim Clausen, Director at HealthNet, and myself, Cameron Gazog, VP at Canopy Health. We're looking forward to sharing with you all the ways CanopyCare can improve the healthcare experiences of you and your family. Let's talk a little bit about the agenda today. On today's agenda, we're going to go over the Canopy Health and its Powerhouse Network, the member experience, your PCP relationship, second opinions, digital tools, and getting care, which will include information about behavioral health and starting a family. Throughout the presentation, we'll illustrate this with the journey of fictional members. So what is Canopy Health? Many of you who have experienced health systems might know that a typical health plan network is built around contracts between the health plan and individual providers, and they usually assemble a network of these contracts. In a health plan network, it's rare and it's very seldom to the providers that the providers in the network work together on topics like access, quality, or the member experience. In fact, they're all kind of doing their own thing. And when you boil the network down, it's more of a financial transaction than anything. So our secret sauce here at Canopy is really our ability to bring the alliance partners together and give them incentives to work together to improve affordability, access, and quality, all geared toward providing you and your families a better member experience. So our alliance partner reputations really speak for themselves, but there's a few things that make Canopy Health and its network quite different from other value networks. First is the Alliance Referral Program, which allows you or your family to seek referrals for care anywhere in the Canopy Health network, not just your own medical group. So if you normally see, for example, a Meritage primary care physician, but you've heard from a friend that UCSF has a really great orthopedic surgery program, you can seek a referral without jumping through too many hoops. The second is the strength of our network. It's important to know that in most networks, there's usually a way to get into an academic medical center if you have to. However, it's really unusual for an academic medical center to lead the charge in value-based care. Our partner UCSF is on the forefront and has made a substantial commitment to value-based care through Canopy Health. Finally, third is that doctors and nurses all around the Bay Area choose Canopy Health as their network of choice, including UCSF, John Muir, and Marin Health, among some others. We're very proud of not just the network we've created, but also the barriers to access we've been able to eliminate. I'll pass it to Mike Robinson, our CEO, to talk about the member experience.
Thanks, Cameron. I'd really like to reiterate the point Cameron just made, which is that Canopy Health Network is owned and operated by health systems like UCSF and John Muir Health, and medical groups like Health Physicians Medical Group, Meritage, and John Muir Medical Group. Our job is to provide access to outstanding health care and support you through an improved member experience. In addition to broad access to care through physician offices, urgent care, and emergency services, we offer video visits through the My Canopy Health app. There's no separate login or account setup, and after your video visit, the notes from the visit are routed back to your primary care physician, so she's in the loop on your care. With the Canopy Health Network, almost all of care decisions are made by the medical groups in our network. That removes unnecessary barriers to care. The plan also offers a range of health and wellness programs, plus acupuncture and chiropractic services. Next slide. Canopy Health is an integrated system of care. It all starts with your primary care physician, someone who knows you and your history. I'll give you a personal example that I think demonstrates the value of a primary care physician. I recently visited my primary care physician, and he saw something with my blood work that was just a little bit off. He took the initiative to explore it further, and I'm thankful he did. Because he knew me, he was able to identify something that required a closer look. And in the long run, I'm much better off because he took the time to investigate what he thought might be an issue. Without his intuition, I'd probably be facing a pretty serious health issue down the road. In addition to serving as a caregiver, your primary care physician also serves as your advocate and your coach. Their goal is to get you to the right care at the right time in the right setting. Next slide. Let's talk about one of the most valuable and unique features of the Canopy Health Network. Most HMOs limit people to the panel of specialists that work together with their primary care physician. Kind of makes sense, but at the same time, if you have to commute a long distance to work, it can limit your access to care. Canopy is different. With the Canopy Health Network, your primary care physician can refer you for care to any specialist across the network. A story I've told my team from time to time is that when I commute into the office from the East Bay, I oftentimes see a San Francisco motorcycle police officer commuting in from the far East Bay. He's noticeable by his uniform and his motorcycle. However, we know there are thousands of city and county workers, firefighters, court workers, teachers, and yes, police officers who commute into San Francisco from outlying communities. As we put it, they need to be able to access convenient care where they live, work, and play. Canopy supports access through referrals to specialty care across the network. Next slide. Here's another great example of how easy access to specialty care can be especially helpful. You've been diagnosed with a condition and you'd like to consult with an expert, a second opinion. We highly encourage seeking a second opinion. In fact, the Canopy Health Network includes UCSF faculty and physicians, some of the world's top physicians. Why wouldn't you want to have access to a second opinion from one of those specialists? With the Canopy Health Network, you're able to arrange a second opinion without hassles. Cameron, back to you.
Excellent. Thanks, Mike. So Canopy Health has both a mobile phone app and a web portal that you can use. It almost goes without saying that all the standard services are available. So searching for a provider, scheduling appointments, viewing lab tests, refilling prescriptions, etc. What's really unique about what Canopy is doing is that whereas with other plans, you might need to log into several different platforms, for example, the John Muir app or the Health Plans app, maybe your employer's app, Canopy Health is moving towards a future that unifies all of them into a single platform. So what does this mean for you? And sometimes we like to look at these member journeys to really illustrate what the experience can be like. And in this case, we have John and Mark and their 2 children. They live in the East Bay. They have PCPs, the primary care physicians in the East Bay, but they both work in San Francisco. So Mark has an initial consult at John Muir Health, and his PCP identifies some abnormalities on a routine lab test, ultimately diagnosing him with a GI issue. Mark decides he wants a second opinion from a doctor at UCSF, and after getting that second opinion from a doctor at UCSF, his diagnosis is confirmed and Mark decides to pursue surgery. So Mark's friend had a similar surgery and recommended a surgeon at UCSF. So Mark asks if for a referral at UCSF using Canopy's Alliance Referral Program. After a successful surgery, Mark has a virtual follow-up appointment both with the surgeon at UCSF and his primary care physician at John Muir Health through the My Canopy Health app. I think this really demonstrates and illustrates what the Alliance Referral Program is like for our members. not only eliminating barriers, but creating access through the Canopy portal. Next, I'll turn it over to Tim Clausen to talk a little bit about behavioral health.
Hi, good afternoon. Cameron, can I just confirm that you can hear me?
I can,
Oh, excellent. Well, good afternoon, everyone. Thank you so much for joining this webinar at 5 o'clock on a Friday. I'm very excited to be here joining the team in discussing the new CanopyCare option. I'm going to talk a little bit about behavioral health and the benefits that are part of the CanopyCare program. So we really need to continue to focus on individual emotional wellness along with physical health. And certainly we're here to help. We are able to offer through MHN, which is our behavioral health division, a very, very big network of providers here in California with 24/7 access to in-person direction and guidance and help to get you where you need to be for all of your needs, whether it be for counseling, psychotherapy, could be treatment for addiction, psychiatric services. Certainly there could be many things that you or your family might need help with. One of the things I think we've all discovered in COVID is, staying at home and being at home has certainly brought to light some of the challenges that we all face on a day-to-day basis. And so we're very happy that we have this 24-hour, 7-day-a-week access and if you prefer, you can be communicated to also via text or via email. So there's in-person and there are digital formats too on how we can help you. In addition to your behavioral health benefits, which provide the services that I had briefly gone through, you also are going to have access to My Strength, which is an app that allows for family members to access various programs that are really can be catered to individual needs, and they really have a broad approach to helping individuals. I can tell you myself, my family, and I have used My Strength. It's a really terrific app, and it's helped all of us in its own way. Certainly, we think about things like stress, not getting enough sleep. Again, things related to what's going on out in the world and COVID, things of that nature. It's really a terrific program, and I really encourage you to take a look at it. There's a lot of information that we've got available to you, and for information about a provider for your behavioral health, you can visit the website that's here at mhn.com. And again, I really encourage you to visit mystrength.com also to get a flavor for what that application has available to you. So I am going to turn it over to Andrea, I believe.
That's right, Tim. Thank you very much. So I'm going to talk to you today about a couple different things. The first one is starting a family. And we all know that starting a family can be one of the most exciting times in your life. And at HealthNet and Canopy, we understand that each family is unique, and we celebrate the diversity of ways people come together as a family today. Any member, female member, of course, chooses an OBGYN doctor from across the entire network. You can pick someone in your own medical group, or you can choose someone closer to where you work if that's more convenient. An authorization is not required for choosing any OB in our network. The reason why it's important to choose an OBGYN and to work with him or her is that together then you can decide what kind of birth you want to have, whether you can choose what kind of birth center that you want, or would you prefer to deliver in a hospital setting. You also will together make a schedule of prenatal visits that will help you be assured that you and your baby are just fine. If getting pregnant is not easy for you, or you're a same-sex couple or a single mom, then IVF may be an option for you, and that is a service that is available under this plan. Now, if you've undergone any fertility treatment, I can assure you from my personal experience that it is both physically, mentally, and emotionally challenging. Don't let that stop you on your journey, however, because we are here to help you, and we have expert nurses who are familiar with all of these treatments, and we're here to help you every step of the way. We have an array of professionals to help you through your process of getting pregnant, being pregnant, and having a baby. We have obstetricians. Those are medical doctors who specialize in caring for pregnant women and delivering babies. We have maternal fetal medicine specialists, also called perinatologists. They are physicians specially trained in the care of moms and babies before they're born when their problems arise. They can even do surgeries on unborn babies. And finally, we have certified nurse midwives. If you choose to deliver with a midwife rather than a physician, that is an option that's available to you. Many of our alliance partners also offer a variety of classes to help you and your partner prepare for delivery. And some of those options include breastfeeding. There are what's called lactation coaches, nurses that are specially trained to teach you the best and most comfortable ways to breastfeed your baby. There's classes on childbirth or birth alternatives. And by that, I mean, you may be interested in the Lamaze method that teaches how to manage pain through breathing, or you might be interested in child and infant CPR. There's postpartum support, because most of us know that, you know, some women can become depressed after all of those hormones leave our bodies. That is available, and there's much more. Those are just a few. And of course, Canopy covers all of your postpartum visits. So before birth and after birth, all of your visits are covered under this plan. And how often you see that doctor is really a decision between you and the doctor. We don't limit the number of visits that you can see your doctor after delivering a baby. Next slide. All right. Instead of going through those bullet points that we just did, I'm going to tell you a story about a couple, and this is what we hope and know that you will experience. So this is about Jane and Pooja. They've been together for 10 years, and they feel like they're ready to start a family. They live in Alameda. They have a primary care doctor in the Alameda health system, so they get their care in the East Bay. One of their friends says, I think Zuckerberg San Francisco General is a great place to get pregnant, or to try and get pregnant with your partner. UCSF reproductive health system is really the best in the nation. So at Jane and Pooja's next appointment with their primary care doctor, they asked for a referral to the UCSF reproductive health specialists. The doctor asked their office staff to get an authorization just like they would for any other routine service. And before you know it, Jane and Pooja have a message that it's okay to make an appointment. At UCSF, Jane and Pooja are supported throughout the whole journey to getting pregnant. All of their options, from simple to the very sophisticated IVF and even beyond, are explained, and those options are all available. In a few months' time, after undergoing treatment, they hear the words they've been waiting to hear. You're going to have a baby. Together, Pooja and Jane decide that they want to have a midwife to deliver their baby, so they choose San Zuckerberg, San Francisco General, don't try and say that yourself, the Mention Midwives program, where all of the delivery is provided by certified midwives. And before they know it, they have a beautiful baby in a very natural way. Finally, Jane and Pooja's postpartum care routinely includes depression screening, and counseling is paired with that from MHN's network of behavioral health specialists. They talk about it and decide that that's a feature that they'd like to take advantage of, and they're given practical tools through their apps if they choose, and they decide to make an appointment with a therapist so they can adjust as best possible to their new family life. Next slide. All right, and I'm going to tell you a second story now. We're back to John and Mark. John and Mark, you met them a few slides ago. They have chosen Net CanopyCare for 2022. Before signing up, John uses all of his available refills through his existing plan so that he makes sure that he doesn't run out of any of his prescriptions. It can take a little bit of time to get everything switched over, so it's a good plan to get your refills and have them on hand. Mark, on the other hand, doesn't take a lot of medicine, but he does use a CPAP machine for his sleep apnea. Mark reaches out to his sleep equipment company to see if they accept his new insurance. They do accept his insurance, so there's no problem there. Back to John. John has a complicated medical history, so he decides to transfer all of his medical records, all of his doctor notes, x-rays, labs, it all gets transferred to his new doctor. So his new doctor has an idea of what has been tried and what is working for Mark. Now, one of their children is preparing to have a surgery, and that surgery was planned before they switched insurance. So John and Mark contact their health plan, in this case it would be HealthNet, and apply for continuity of care. That application is reviewed by a nurse and doctor, and they decide together what the next steps are for John and Mark. They decide together, after talking with the continuity of care folks, that they still have a few more questions about how to access the large Canopy Health network. So they call the CanopyCare's Care Ambassador program. Their Care Ambassador, who is a medical assistant specially trained and knowledgeable about the Canopy Health network, can talk to them about all of their options and offer some guidance on how to access anyone in the network that they need to see. Finally, John, Mark, and all of their children have transitioned without a problem, and they're now part of CanopyCare. And if they need to, they can make a non-urgent, they should make a non-urgent appointment, with their primary care doctors and their pediatricians. Get to know them before you're sick, and they will get to know you. Next slide.
Perfect. Then turning it back to Tim.
Yes, so thanks so much for that information, and again, glad to be back with the group. So I wanted to answer there's a question in the chat with regard to behavioral health, and there's want to answer that in as far from a benefit standpoint, and then more importantly, what are the best next steps in order to ensure, if you're interested in behavioral health coverage, on how to get more detailed information, maybe more specific to what your question might be. So the behavioral health coverage is, there's an office visit for actual doctor visits, it's $25. And then if there's from an inpatient standpoint, there's a $200 per admission deductible. That's just kind of the black and white nuts and bolts of the benefit. But in order to ensure you are getting your specific questions answered, I would recommend to going to the San Francisco Health Service System website and go to the link which takes you to medical plans for HealthNet. And within there, there's actually a couple phone numbers that a couple that you can call. One is directly to MHN. The other one is to our member services team, and they should be able to help you with any specific questions that you would have. Also, I'd encourage you to take advantage. There's actually 1 week left of making one-on-one appointments with someone in our member service area to ask any specific questions. And I know there's still some openings for next week. So I will pause there and see if there's from the team presenting, if there's other questions on that particular topic.
And Tim, this is Cameron. The website on the page here, healthnet.com/SFHSS. Can our listeners, can they go to that website and find a place to make appointments for one-on-one sessions? Yeah,
thank you, Cameron, for calling that out. Yes, they can. So once they get to that page, there's an opportunity. It's right there. It says 2022 SFHSS open enrollment office hours. Schedule a phone appointment with the representative now. So that would be the place that they would go, and we would make sure we get in touch with them at a specified time and answer any questions they might have. Also, would like to just share in general, as we're new in this offering, that most recently HealthNet has been awarded one of the top service providers in the country for our customer service. So we are very committed to ensuring that we're answering all questions, and if we don't have the answers, of getting back to individuals. But we've got a very tenured staff that's standing and ready by to help out.
Perfect. Thanks, Tim. So let's do this. Why don't I hand it back to Jessica to talk about the great raffle prizes available.
Great, and our Q&A moderators are going to put this in the link because we want to thank everyone for attending today. So please fill out, it's just a really quick form. We just need to know how to reach you in order to send you the raffle prize. So if you could fill that out, we would greatly appreciate it. Also, I'd love to go into the live Q&A portion of this webinar and go down the questions to make sure that all of our audience members can hear the answer. So the first question is, hi, trying to understand the difference between Canopy and Blue Shield HMO. Are there different providers? Mike, I saw you answer that earlier, but could you elaborate on that and tell all of the listeners here today?
Yeah, so first off, I would recommend that plan participants go to the SFHSS microsite and compare networks. There are some differences. I believe in San Francisco, two of the differences are Canopy offers access to Chinese Hospital and also Zuckerberg San Francisco General. The other point I would make as far as a difference with the Canopy Health Network is something that we touched on earlier, where with Canopy, your primary care physician can provide a referral to any specialist in the network. You're not limited to the panel associated with that primary care physician.
Thank you. And the next question is, could I have my primary care doctor at John Muir but go to UCSF for dermatology?
And the answer is yes.
Great. And this was the question that Tim answered earlier, which is about our member just wanted to know what is the mental health coverage. And Tim, I know you had already addressed that earlier, but they do use the MHN network. And he had specified the exact coverage, but you can also go to the microsite, which if you can go back one slide, is at healthnet.com/SFHSS. And thank you, Marissa, for putting in the chat the how to get a one-on-one consultation with a Health Net CanopyCare representative. And we also have another question about Medicare. How does Medicare or Advantage plans fit into CanopyCare? And unfortunately, SFHSS does not have a Medicare Advantage plan with CanopyCare. And what happens if the patient needs to be placed in a skilled nursing facility? Who decides? And who decides, and how is the payment covered by the plan or patient? Or is there a shared cost, and how much?
So maybe Andrea, you can take the first part, and Tim, maybe address the second.
Sure, I'll take the first part of that. If a member is in the hospital and needs skilled nursing care, that decision is one made by the doctors and nurses taking care of the individual. And we have a large selection of skilled nursing facilities that are available. And the decision on where you go is a shared one with your doctor and nurse. And Tim, do you want to talk about the benefit and the copay?
Yes. Oh, and just to go back, I'm not sure, but I believe the member is asking who decides. I'm not sure if they're asking where the patient should be placed, or if the patient should be placed in a skilled nursing facility. Are there, I don't know if there's like qualifications or anything that would trigger it. Like, why would a member need to be placed in a skilled nursing facility? And whomever sent that question, please correct me if I'm wrong. Please let us know if there's more to your question.
Some of the reasons why a person would go to a skilled nursing facility would be if they need additional physical therapy after being in an acute hospital, if they need additional occupational therapy, or any type of rehabilitation that requires someone with a license to provide the service. So it's dependent on each individual's medical needs.
Thank you for that clarification. And I know somebody else was going to follow up by how's the payment covered by the plan, and how's it shared with the patient? What are the costs?
Yeah, I can take that, Jessica. This is Tim. So for skilled nursing facilities, the member responsibility is actually, there is no financial responsibility, but there is a limit of 100 days per calendar year for skilled nursing facility. So it is $0, but limited to 100 days per calendar year.
Thank you. And the next member asks if they are with affinity for dermatology, which accepts Blue Shield. Oh, thank you, Mike. Is that covered in CanopyCare? Mike, can you answer that?
Yeah, the Affinity Medical Group is not a participating provider in the Canopy Health Network.
Okay, great. Thanks so much for clarifying that. And if you have any more questions, please feel free to drop it into the Q&A chat right now. And if not, please sign up for our raffle prize giveaway, because we would love to thank you for joining us at this hour, 5 p.m. at night on a Friday. We would love to thank you for joining us. So we hope you will participate in the raffle. We'll just wait one more minute before closing out this webinar in case someone else has a question. Oh, I see one more new question. Are services provided by Virta Health? covered?
Mike?
You know, I am not familiar with Virta Health, so I'll have to admit I don't know. Andrea, do you recognize them?
No, I do not. I was just Googling them.
Yes, I often do that myself.
So it looks like Virta Health is a virtual care network related to the care of diabetes. And I can say that Canopy does have online tools for helping an individual manage their diabetes care. And we do have virtual care visit options, but just not through this particular network.
Thank you, Andrea. And correct me if I'm wrong. I believe for diabetes management, CanopyCare and the HealthNet partnership uses Omada.
That's right.
Can you elaborate on what Omada covers and why Omada was selected?
Tim, that one's for you.
Yes, so Omada has been our partner, and they have there is a at a very high level there is a qualification or an assessment done for individuals who are interested in joining the Omada program in order to help manage their condition. And if the person qualifies as a candidate and a member that would value what the Omada program brings, which is their taking care of their condition, making sure that their testing is occurring appropriately and getting all the appropriate support that they need, then they would be assigned a set time program to work with the team at Omada to improve their, amongst other things, their blood sugar, their weight, and a couple other important keys to health in the area when you have diabetes. So hope that's helpful.
Can I just add a little bit to that? I've personally seen the Omada program. They offer coaches for individuals depending on what the need is of the individual, and they also have virtual online peer support groups where people that have diabetes can talk with each other about what works for them and how they manage their care. And I think that's one of the really cool features of the Omada program.
Thank you. And I do see we did get quite some few questions that came in. So Tim, there's a follow-up regarding mental health therapy. If they find a provider listed under the MHN network, does that mean it's covered under the HealthNet CanopyCare insurance?
Yes, they would be covered. Yes.
Great. And is the patient responsible for full cost of skilled nursing facility if care is needed beyond 100 days?
My understanding is yes, but I think that would be also a great question for one of our member service team members to ask also that very specific question. But my understanding is yes.
Great. And I'm not seeing another new question. We did put the Omada Health link in the chat for our member John. Please let us know if you have any more questions. We'll keep this webinar open for another minute just in case any of our members have questions. Okay, well, if there are no more questions, we want to thank everyone for joining us this evening, and we hope you have a wonderful weekend. We hope you got the information you need to make your open enrollment decisions. Remember, this coming Friday is the deadline to make your elections. Please use the employee portal and go into e-benefits to make your open enrollment elections. Thank you and have a great evening and a great weekend.
Thank you.
Thanks, everyone.
Bye.